Okay.
So good afternoon, everyone. I believe we have a quorum. As soon as Kathy turns the volume up, so I'm not echoing. Okay, so this is our first meeting in January. And as we start, because it's our new chair, our first meeting, I wanted to ask Dr. Phil Chen to just welcome him on behalf of the advisory and introduce him. And then he will take the lead for the rest of the meeting.
Thank you so much.
On behalf of OSAC, on behalf of the Health Department, I'm really pleased to recognize Brandon Marshall. I think he's been an important part of this group, important part of the community. But professor of epidemiology at Brown University, trained in British Columbia. He's one of the foremost experts, not only in the state, not only in the country, but really internationally related to substance use. So we are absolutely incredibly lucky to have him in general in the state and certainly leading this. So Brandon has been one of my go-to people to call behind the scenes for lots of things. I'm absolutely thrilled to recognize him as chair of this committee. So thank you, Brandon, for accepting and for being here.
Thank you so much, Phil. That's so kind. Happy New Year, everybody. Thank you. I'm so thrilled to be here in this new role. As you may know, I was a member of the OSAC for 2 years and now have been very fortunate to be appointed in this role as chair. So I look forward to working with you all in this capacity. So we're going to go ahead and get started. Would you like to forward the slide, Mariama? We've got a great agenda today that is focused primarily on process. So we're going to hear some updates from the Overdose Task Force, from Kathy, and then I'd like to use most of our time today to talk about what the next year is going to look like, particularly as we build up to the key vote to make allocation recommendations in August, and get input from all of you on how we feel like we should spend our time most efficiently and effectively as we work up to that key decision. The other process piece that I'd love input on today that we'll get to a little bit later is the selection, nomination and voting on new members. So we actually have one community and one expert advisor who are cycling off the panel at the end of April. So we'll talk about that more later on in the meeting about what that's going to look like. That will be the focus of our March meeting. And then we will move to public comment and then adjourn this afternoon. Next slide. Right. So I just would like to take a moment to have all of the committee members introduce themselves. We actually have a new member as well, and then the UHHS staff as well. So maybe Dr. Burke, I'll ask you to kick us off with the intros.
My name is Dr. Justin Burke. I'm an internal medicine doctor. I am serving as one of the members of the committee.
Chan, physician at the Rhode Island Department of Health.
Rich LeClaire, director of PhD.
Angela Como, community representative.
Rachel Ferrara, City of Providence. Alex McMago, Assistant Professor of Epidemiology at Brown.
Dennis Baylor, Older Profession Program Director at Project Beverly Hill. Eco Lincoln, Community Representative.
Matt Moynihan, I'm Chief of Police in South Kingstown and represent Washington County.
Jeffrey Veron, the Fire Chief in the town of West Warwick, and I'm representing Kent County.
Okay. And our UHHS staff.
Oh, sure. Anna Nuvaish, still Assistant Secretary for EOHHS.
Kathy Schultz, the Director of the Governor's Overdose Task Force at EOHHS.
And Christina Schultz, Lead Analyst for the Overdose Task Force.
Michelle Goncalo, Administrative Financial Management at OHHS.
Tamara Berman, Program Evaluator.
Mary Jala, Project Manager, all things OSAC, OHHS.
Great, thanks everyone. And I'm Brandon, please call me Brandon, Professor of Epidemiology and new chair of the OSAC as well. So I think we have to start with approval of the minutes from November's meeting. Can I get a motion to approve those minutes? Great. And a second? Thanks, Miko and Phil. So those minutes are approved. If we go to the next slide, Mariama, I'd like to actually start before we get into the discussion today and the updates from Kathy, just on some housekeeping and some guidelines that I'd like to offer and we can discuss as a committee. The first housekeeping announcement is that we've made some attempts to improve the audio quality, especially for our members of the public who are attending on Zoom. So there are 2 microphones here near Kathy and near myself. which should be able to pick up the committee members. But we ask that you speak loudly and clearly so that people on Zoom can hear you. And we'll let Mariama or whoever is monitoring the chat let us know if we're having audio issues. So this is also one reason why we moved to this location, is because of the improved technology for conducting the meeting. So that's one housekeeping announcement. And then I'd also like to offer some guidelines for conducting ourselves in the meeting. This is actually from the Reframe Health Justice Group that worked with the Racial Equity Working Group of the Governor's Overdose Task Force. And I thought these were really tremendous guidelines with which to hold ourselves to. So I'd like to offer them to you as guidelines for us to use. I'm not going to read them all out. They're there for you, but I just wanted to highlight two today that I thought were particularly compelling. One was make space and take space. I love this one. You know, if you're someone who speaks up a lot, takes up a lot of room, typically encourage yourself to give opportunities to others to speak up and to use that space. Likewise, if you're someone that typically is shy or kind of withholds from making comments, I encourage you to challenge yourself, push yourself to speak up in the meeting. We all have something valuable to offer here. So please do, and I will do my best to make sure that everyone has a chance to speak who would like to in our discussion. The other second piece that I wanted to highlight was that last bullet point. I'll ask everyone to please be respectful of each other's opinions and comments in the meeting. You know, the idea here is to criticize and interrogate the ideas, not to attack or discriminate or harass other members or members of the public or EOHH staff. So that is certainly unacceptable behavior. We want a robust and sometimes challenging discussion that's focused on the ideas, not attacking individuals at the table, out in the public or the staff. And finally, one thing I wanted to add as well, at the last November meeting, a member of the public made a great point that I just wanted to lift up, which is to encourage us to use destigmatizing and person-centered language whenever possible. So I ask that we all hold ourselves accountable to use that language. If you hear language that you feel is stigmatizing or dehumanizing, please let me or an EOHHS staff member know, and we can convey that back to the committee next time, you know, to all work on improving our language and make sure it's person-centered and destigmatizing. Okay. I'll stop for a moment and would love feedback if folks like this idea of adopting these guidelines. If there's anything else you'd like to add, we could certainly do so. Thumbs up. Okay. Awesome. Thanks, everyone. All right. I'll turn it over to Kathy, who will provide updates on the Governor's Overdose Task Force.
Thank you. Hi, everybody. I'm going to stand up so the camera can see me. I'm going to come in the middle a little bit so everybody can see me. Welcome, everybody. Thank you. Welcome to our newest member, Chief Arone. We are very thankful to have you here. I know I am. And welcome to Brandon, and thank you for taking the nomination or the recommendation and joining us. So I just want to go over this quickly, and we do have a couple of slides that I just want to show you. I'm going to be very brief about it, and there may be additional questions, so I'm going to take my notes, but I might have to refer you to the Department of Health on some of the slides that are here. And refer you to some resources. So in our last December task force, we looked at the fatal overdose data from January to June of 2024. I want to make sure to just be clear that this was not the whole year. This was just the first 6 months, because it does take time to confirm those fatal overdose deaths. We also had a presentation from the treatment work group, and we had a presentation for the pregnancy inpatient hospital admission. And I'm going to get into this a little bit more so we can move to the next slide. And because I want to show you the announcement about our community overdose engagement. I'm very excited about that. So I want to start off with this, and I know that Rido would do this as well. I used to work at Rido, and we all made a commitment to say that whenever we're looking at data, that remember that every single number there is a person, and that we want to frame anytime we look at any fatal overdose data, although we have to look at it as numbers, that we know that there are people that are directly impacted, loved ones who have lost somebody to a fatal overdose. And you can't see it. Could you move by any chance so that I can
Video
see?
box for you.
And so everybody can see the data. There you go. Thank you. So what we noticed was that right now, this is what the data is looking like. We have 192 lives lost to fatal overdoses. You can go to the next slide because this shows you the picture a little bit better. And so there was a comparison done. I want to thank our colleagues at the Department of Health because this is a lot of work that they put in to looking at this and trying to get this information out to us as soon as possible. We are seeing that there's an 11% reduction in lives lost for the first quarter of 2024. Now I know that the Department of Health would say this. It's very important to remember that we don't know what's going to happen in the next 6 months. And sometimes we can look at trends, but trends change because of drug supply and many other things. But right now we are moving in the right direction. 0 is what I want to get to, and I'm sure everybody else here does. But we need to see these decreases. And the next slide is our January. I know we're moving quickly out of that. Can we go back to that slide just for 1 second? Does anybody have any questions on that? Angie?
Yes, I noticed that these slides with the overdoses over the course of years, there's a red that are not opioid involved. Can you tell me a little bit more about what the primary involves? That's like what are the primary reasons for those tests?
So I would actually refer you to the Department of Health to answer any of those type of questions. That question was asked in the Governor's Overdose Task Force. And if you go onto the Prevent Overdose RI website, you can actually hear the presentation and listen to it or see it. I don't want to speak to the data when I don't have it in front of me. This was actually just a snapshot because it is important that you all are informed. I can also, if anybody's interested, I can connect you as well. I can be that conduit to make sure that if you have specific questions after you're able to listen to the presentation, see the entire presentation, and you have questions, you can just send them over to me and I can make sure that you're connected to the data stewards. Okay. Unless you know the answer.
Well, it's a number of different substances that are involved. It's not, yeah.
Wait, you would need more information to answer that question. Thank you. Okay. Yes, please. I want to announce, and Director Leclerc, you're more than happy to add to this announcement. We did have a presentation of the treatment work group. And we also are excited to announce that January is Substance Use Disorder Treatment Month. So we really focused on our treatment work group. And we had a wonderful presentation by Linda Mahoney to show all of the amazing work that the treatment work group is working on. And again, there are presentation archives if you're interested in seeing more about what that presentation entailed. There was a lot of information there. Happy January Substance Use Disorder Treatment Month, and that comes from SAMHSA, correct? Yeah, awesome. Anything else to add or questions? Okay, we can move to the next slide. And so we have a wonderful announcement. The registration link is in the process of being finalized. You should receive this in your emails. It will be sent out to the OSAC committee. It will also go to all of the work groups in the task force as well as the task force. We will be holding our 2025 statewide Community Overdose Engagement or Code Summit. Some of you are familiar and have been there in the past, and some of you, this might be your first one. Please join us. It is an amazing event. There are going to be many opportunities to learn and interact with fellow Rhode Islanders invested in ending the overdose crisis. We are really targeting our municipalities and hoping that our municipalities join us, as well as our health equity zones, because this is really focused on, again, local level, community level responses. So please join us, and that registration link will come out and we will make sure that that gets over to you all. And that will be held at the Crown Plaza. I always like to talk about food. Some people like food, I like food. Free breakfast, free lunch. So everybody knows, and it will be all day. We will not be having the Governor's Overdose Task Force in February. This is not a task force meeting, but it will be in place of it. And so we're canceling the task force. Any questions from committee?
The intended audience for this is the service providers or?
Actually, it's the health equity zones, the municipalities, all service, it's everybody. This is usually a very well-attended event. Over 200 people usually attend. It's really to come together as a state, and those who are providing services have the opportunity to table. So there'll be lots of information tables around. And we really want to make sure that we're bringing our municipalities in and providing some information to the municipalities to help them with developing overdose response plans if they don't have one, or getting some kind of technical assistance, learning how to use the PORI website, learning how to use the Rido Data Hub, coalition building, and also some workforce. Those are the 3 breakouts in the afternoon.
Would community organizations have an opportunity to secure a table there?
Yep, we're going to be sending those out, and your organization is on our list. Yes. Anything else? I have one more slide. And I will present this, and Brandon, feel free, because this is actually a project that you lead, your team leads. I want to remind everybody, we talked about archived presentations. We talked about some of the ways that we get this information from the task force to the public. And remember, there's also an opioid settlement page here. But I really want to just highlight where you can actually find those presentation archives. Prevent Overdose RI has been doing this for what, 10 years now?
7, 8 years, I think.
Yeah, it's been a long time. And
yeah.
this is the main dashboard for all things overdose. So if you're interested in getting involved in any of the work groups, looking at presentations on your own leisure, or just listening to them because they are recorded, or you have any other questions about the action plan, and at the top, you can see we presented this before, that there is actually an opioid settlement page. And we can't, this isn't interactive, but in Get Involved, we actually have a funding page that has landed, that gives some funding opportunities. The funding opportunities there are only as good as what information we get. So they're not always as up to date as we want, but we're working on that process, right, Brandon?
Yeah, yeah.
And there's lots and lots of historical information on that page. Any questions? Okay, great. I'll put it in the chat as well.
Great. Thanks so much, Kathy. So I'd like to go to the next slide, Marina. Thank you. I'd like to spend the bulk of today's discussion on process and planning as we look to the next 8 months leading up to that critical vote in August, where we vote on recommendations that then go to the secretary and on to the governor. So I'd like to spend time with that. I have a few slides just to orient us to this discussion. Many of you will have seen this information before. It's very brief, but I thought it was useful, especially for our new members, just to provide a quick orientation to how we think about this, what the committee is, and then we'll get into the discussion. So if you go to the next slide, Mariama. This is actually my favorite slide from all of the many slides that we've seen in this set of meetings. And it's the way that I think about orienting us with making decisions at a high level in terms of allocating funding to address the overdose crisis in Rhode Island. This is called a continuum of care model. And the goal here is to see all Rhode Islanders through to that state of recovery, right? Where people are leading healthy, happy lives and are no longer at risk for overdose. That's the goal for all of us in front of us today. We have divided the continuum of care into these 5 buckets, and we largely make funding recommendations to align with these domains. Social determinants of health, harm reduction and rescue, treatment, recovery, and then undergirding all of that prevention. So we as a committee largely have to make decisions around the relative investments we make in these buckets. We want strong social determinants of health to support people, housing, we've talked a lot about in this committee. We want robust harm reduction and naloxone infrastructure to make sure people can stay alive when they're using substances and when they may be not ready for treatment. We want a robust and evidence-based treatment program that's available to all people who want treatment. And then, of course, we want to support people who identify as living in recovery. And all of that, again, is founded by strong prevention programs to prevent substance use and addiction in the first place. So that is how I like to think about this at a high level. And then over the coming months, we'll drill down into these in a lot more detail. But that's the big orientation that I'd like to provide. If you go to the next slide, Mariama. So just very briefly, what is this committee for folks who are new to it? We are an advisory body of 17 members, 6 state representatives, 6 municipal representatives, and 5 community and expert advisors. I want to come back to that last bucket later because those are the people who we vote to sit on this committee. The 12 other representatives are appointed by various bodies, and Kathy and I will talk about that process a little bit later in the meeting today. We oversee 80% of all of the settlement funding that came through the Attorney General's office. That is directed by the state and is what we advise. 20% of the funding goes to municipalities in a formula. We have no oversight over that 20%, although we try our best to align with what the municipalities are doing. We have municipality representatives here, and we've asked municipal representatives to come and present to us as well on what they are funding and supporting. And finally, my last note here is that our recommendations go to UHHS, onto the Assistant Secretary of Health, who either endorses them or pushes back on them. And then if they're endorsed, they go on to the governor and put forward into the state budget. So that's the process. Next slide, Mariama. So these are our current representatives. We have 3 experts, 2 community representatives. Keep that in mind. We have 2 cycling off in April, so we're going to come back to that. And then the other state and municipal representatives are listed there. Okay, let's go to the next slide, Mariama, with the discussion. The goal for today is to really get insights from you on what would be most helpful as we start to discuss allocations for August 2025. We want to know what you need to make informed and solid, good decisions in August to support funding recommendations and allocations. Before we get to that discussion, I just wanted to summarize what we have discussed in general. UHHS was kind enough to put this slide together, mostly for me as a new committee chair. I've not been attending the last few meetings, so this is a summary of what I believe you have discussed over the last few months in terms of what is important for informing your decisions. So we've talked a lot about, in terms of our past approach, we need to spend this money. We have spent this money quickly. We need to get the money out the door. The crisis is urgent. People are dying every day. We've made decisions, sometimes in absence of all the information we might want, in order to meet that need, that urgent need that is out there. So that has been one aspect of decision-making, is getting the money to people who so desperately need it. The second principle that we talked a lot about is sustainability, right? The funding ends in 18 years, and it actually decays significantly year over year. So we need to start thinking about how to make sure the programs that we invest in are sustainable, right? So that's been a theme in the meetings I've attended and since then as well. There's been a lot of discussion on the need for evaluation research, right? We want to know what is working. Are these programs that we're investing in evaluating? Are they impactful? Are they reaching people? Are they providing effective services? And finally, coordination, right? We want to be coordinated as a committee with other decision-making bodies, notably the task force in the state that provides recommendations from the community members, people who are directly working with folks on what is needed. And we aim to coordinate with those efforts and listen to them to help inform our decisions. So those are some of what I've heard and what I think has been discussed as a committee over the last several months. But I'd like to open it up now and hear from you. What else? What else would you like to see? What do you need to help inform your decision-making in August? So if you go to the next slide, let's open that up. Yeah, go ahead, Todd.
So I think one of the things that I'm curious about is what is building, how has this problem changed? As we see reductions in one area, do we see increases in something else? So really establishing a common operating picture as to challenges as we go forward.
Yeah, Phil.
So I think, and this came up, I think, last year as well. The first grants were awarded in 2022. Is that a correct statement? 2022-ish, first grants?
Yeah.
Yes. I know that EOHHS is working on a broad level dashboard, which is wonderful, and I think it looks great. I think what would be helpful, and what came up last time, which would be helpful for this time around, is to see exactly with the organizations, what organizations are getting how much money and some sort of more process level sort of middle outcomes. And so examples of what that can mean, for example, is how much money did we spend on recovery? How many beds did that lead to? How many people were served by those beds for treatment? It could be how many people actually received treatment and how much money was spent. I think we need a little bit of a better sense of how much money is going to some of these specific things. And what are some of those middle outcomes that are eventually leading to those, like the overall fatal overdose reductions as well. So that would be helpful in terms of trying to guide to see what's most effective based on some of these process-oriented outcomes. And that will help us better allocate money between the different pillars. That's great.
Yeah, Rachel.
We had started a discussion about potentially investing some money to be able to then make it last longer to sustain programs. I'd like to pick that conversation up again and have a better understanding of what that might look like, because I think if we plan now, it's gonna benefit us in the long run.
Okay. Yeah. That's great. Yeah, Andy.
I'm going to build on what Dr. Jan said, because I do think like one of the presentations that really most stood out to me and the most helpful is the one where we got very specific information, concrete information about treatment beds and spending, where you can track money went here and this is what we got. And that may not be possible with everything, but to the greatest extent possible, to provide a review of where money's allocated, where it actually got granted to, and then whatever the interim reports are from those providers. That information would be very, very helpful. And I thought your slide actually did a very good job of kind of categorizing how to think about these different needs. But one thing that I've consistently said and has been done is we got to figure out where our money is situated in the big picture. So additional federal funds or additional state funds that are going, of course, I know budget is going to drop imminently. And so we will obviously want to be informed by that new budget.
Yeah.
So I think that's good. And then on the little bit about what Todd said, I think communicating the needs to us, right, which I know you get from the task force. Another way to think about what you said is emerging needs, which we can, I think, hear about from folks in the community who are on the front lines.
Yeah.
And what are they telling us? So how we can get that information in a way that we can use it.
Okay, that's great. Yeah, Dr. Larkin.
Thank you. And I've been with you virtually the entire time, but here I am now. And I guess I can talk. So just to follow on both those points, one is like, what are the early signals that we might be picking up in terms of both success as well as ongoing issues or emerging issues. So, certainly one of the things I was struck by at the last task force meeting was the sort of synergy between different substances that might be being used and how those might, that might represent a kernel harder to reach people and or populations. So that's one thing. And then the second is kind of getting to the, not just the midpoint metrics or measurements, but also trying to understand what can we measure in any given allocation prospectively, recognizing that not everything can be measured. It's and much around the epidemic, I think, can't be measured. But are there things that we can measure that we can actually define for the people who are implementing program so that they know what we're going to be asking them in 12 months or 18 months or 24 months or whenever it is that we sort of try and look at it again?
There's.
Keep on the theme of outcomes and evaluation. I think as much as possible, looking as to how we're targeting interventions or addressing communities of color and other hard to serve populations that have different outcomes than what is being reported or have a greater higher prevalence of overdose could be important in having us allocate and evaluate allocate the money and evaluate the programs. The other aspect that I always like to see what context we're in with other states. So not every state has the same lift. So that's always hard to judge. So other states are getting higher reductions in overdose, but were they so high for lack of intervention over many years that they've got I don't want to say easier lift, but more difficult than ours, but still some way of comparing them, since a lot of the overdose happens to be on the coastal states and not so much in the country. So, how are they approaching certain things and what's working? Because I'm sure there are learning communities out there. So some way of synthesizing that and providing us with that information.
I think that's a great idea. I was part of some national learning communities, and what I learned was that states are doing this very differently. There's like 50 different natural experiments going on. And so I'm happy to share some of those learning communities resources, and then we could try to identify people who could synthesize what is happening, what can we learn from other states that's working. One thing I want to highlight is that we are at the highest end of the state allocation. So the proportions, the 80-20 varies a lot. We have the highest percentage of state allocation, I think. Other states, almost all of the funding is going directly to municipalities and counties. So that's a big difference. We might want to compare to states that also have high state allocations, which would be more similar to us. I think that's right? I'd not put you on the spot, but yeah.
I think so in some states, a lot of the healthcare infrastructure is on the county, sometimes at the municipal level, whereas in Rhode Island.
Yeah.
So I think the only state that had a higher allocation, or maybe the 100% went to the state, is Delaware. And I think that one of the realities, this is like zero scientific or medically valuable rationale behind it. It was because their municipalities didn't pay. So, ours did.
Kathy, Miko, yeah.
I just wanted to mention, we invest in these buckets of different, agendas, like the recovery, the prevention. Ultimately, we are invested in human beings, right? And some of the capital that would the recovery capital metrics, beyond, just if the person, got a bed, or got a job, the anecdotal, family supports and, building relationships and the confidence that a human being needs to be able to sustain their own recovery. I know it's a difficult ask, but maybe if we can get some more of that information, I think that will be helpful in trying to invest in ideas such as that, if I can say that.
Yeah.
Not as articulate, but.
Oh, I love that. Yeah.
I just want to echo Miko. I think that's an important thing where, especially when there's not metrics to be presented or a number that we can have, having the granular organizations that are receiving money or individuals that are benefiting from the funding present on what the successes might be that aren't captured by a specific number. I anticipate would be helpful to understand where the money's going and where it's back.
That's great. Another way to think about the question that Adi pointed out is think about the presentations or the meetings that you found most effective. If you think back, if there's any presentation topic that you found very helpful in your decision making, let us know that, and we can certainly do more of that, right? Okay. Thanks, everyone. This is helpful. Shall we go to the next slide, Mariama? One thing that Kathy and I discussed at length and that we also wanted your feedback on was the meeting cadence for the Settlement Advisory Committee. There's nothing that says in the settlement that we have to meet monthly, and we would like to propose to you a different cadence where we try to maximize our time together and try also to get one goal we talked about was to get more information out to you farther in advance so that you can digest the information in advance and we can spend more time in the meeting in discussion. So that is something that we can commit to. I assume, I shouldn't speak for you, HHS. Yeah, nodding. Okay, great. So this is the proposed meeting cadence that we would love feedback on. So again, that big decision comes in August, right? So sadly, a lot of our work is in the summer. That's just the way it is. So what we would like to propose is that our next meeting in March, and we'll get to this in a moment, is where we vet and discuss and then vote on the new community and expert representatives. We can certainly do other things, but that would be the primary goal of that March meeting would be to go through that process, which happened last year, and we'll talk about it more in a moment. And then the real chunk of our work would be in those June, July, and August meetings. Typically, what has happened is, I think it's the May task force meeting, is that right, Kathy, is where you hold the community conversation. Yeah. They do breakout rooms. We get feedback from the community on where the needs are, where the emerging issues are, where we really see the community telling us they need more resources. And then Kathy and her team are responsible for synthesizing that information, and that's presented to us in June. Then in July, we would have an additional meeting where we try to obtain and bring back to you more information that you might need to help inform your decision-making around recommending allocations, whether that be more detailed data on programs, charts of what is funded, what that funding, what the timeline of that funding is, things like that. And then in August would be our formal vote for the recommendations, which then go to the secretary. Fall, we're less sure. And that's one, I think, area where we would love your feedback on. How can we use our time in the fall most effectively? What would you like to hear from? We thought maybe 1 or 2 meetings in the fall might be sufficient to meet our goals, but would love to open the floor up to, what you feel would be most helpful. And I guess in general, what you feel about meeting less frequently, where we dedicate specific meetings to these specific topics. Kathy, anything you want to add to that proposal?
The only other thing I want to add, and I actually can't take credit for it, but I agree with it, is that the cadence to be consistent, and that would be the 4th Wednesday. So we have, Mariama has made sure that we have this room all year on the 4th Wednesday, so we can then decide which months we want to choose. But having that consistent 4th Wednesday, I know from experience, makes it a lot easier for us and also for you all, so that what's coming instead of it being on a Monday or a Tuesday, because we were flexing them all around. And so I guess one question I would have is, does the 4th Wednesday of the month, is that a conflict repeatedly for anybody here? If you don't know off the top of your head, you can always let us know. But that's kind of what we chose because it made sense for our calendars and it's consistent throughout the year. And then you all will decide on the cadence.
I think the bigger issue, just to revisit, even if the answer is no, is just the summer. So I was wondering, well, you have meetings in June, August, those are all hotspots for vacations. I think to make some of these decisions, it would be best to have the core sort of group here and people to be able to attend all of them, probably. I guess one thought would be, Kathy, would it be possible to move up some of the task force work till April? So then maybe we could all meet and do some of this in May. And then is it even possible to move that August 27th to the first week or 2 of September? So we're trying to do the end of the spring and the beginning of the fall.
So we would have to ask the community if they would agree to move their community conversation that the state agreed to from May to a different month. So that would be I am willing to do whatever, but I can't speak for the community and the decision that was made by the state when the state was asked to hold community conversations twice a year. That would be my only response to that. We would lose that piece of that breakout sessions. If I could find a way not to have all this in the summer, believe me, I would.
And I don't think that moving from August 27 to the first week of September would make a huge difference in the state budget process. The August timing is because of when we start working on the budget that we submit in October. So we wanted to have enough time, but a week, because the meeting is now in the last week of the month, it should be easy to make that change. That's an easy one that we can commit to. While the other one, as Kathy's saying, we want to check in with the community members. But I think, honestly, I think for the community, I'm not speaking for the community, and we definitely should give the community the respect of asking. But I hope that from an ease of process and having the money go better for everyone, it's not that we are removing that conversation, we're just changing the date of the conversation, but we are still committed to having twice a year the conversation. And I think that's probably the most important thing from a community perspective, is that we're not shying away from having those discussions. But I shouldn't speak for the community. We need to ask them.
Dr. Larkin?
So I would, as a long-suffering parent and member of an extended family, I would say that the most vulnerable date there is July 23rd. So how about if you don't do that one, but have another meeting in June after the community conversation? And then you've got, because that's when you're going to have the most problem getting a quorum. June 25th is still, some schools are still in session, et cetera, et cetera, et cetera.
Yeah.
August 27th, college kids are already going back. So, the time that people are going to be taking off most likely in that, and those 3 days are the July 23rd one.
Yeah.
And you may not be able to get a quorum.
Yeah, makes sense. Other feedback? Yeah, Director?
The other element you got to figure out is, when do we have information about the effectiveness of the current programs or the change in needs? Otherwise, it makes the discussion about recommendations on allocation of the following year a little bit in a vacuum.
That's right.
So if that information is ongoing or summarized before some of those discussions. The other thing to note is the way I think the funding cadence works is that by the time we decide in August what we want to recommend to the secretary, and that goes in the budget and it gets approved the following June, and it gets allocated to the various departments to go out to bid to get the proposals to award it, you're talking almost 2 years. So what we may end up recommending in August of 25 will hit the street until sometime in 27. So maybe we want to look at having funds available a little differently than on that spring cadence.
I'll ask someone to jump in from UHHS if they know that. I think there's some flexibility, right, with some hold in some money that can be used in a more timely fashion, I want to say.
So that is ongoing, that's current budget that has been allocated that we're working under. So that's existing, and there's flexibility in the sense that if there's any funding that is not allocated, there was an emerging issue, can be brought back into the community as long as it's in our budget. So that's that piece. The timing from, as Director Leclerc is talking about, so when we do the budget in July, so we already have also your budget for we submitted recommendations that were submitted last year. It's what's informing the budget that is going to start this July 1st. So you also have funding that will be available. There's always, easy way to say is there's always money that has been allocated on an annual basis. And that's based on recommendations from this committee. And if there's any emerging issue, there's always the flexibility to come back to this committee to say, there is this emerging issue, we have X number of dollars available, what's your decision?
We also have a bucket that is emerging issues as well. So if there's issues, we work very closely with the state agencies. So when there are issues that arise, we are able to be flexible.
I mean, the budget timing is the budget timing that works for every single penny that is spent by the state. We are always on that cycle, not just for this funding stream.
Yeah.
All funding from the state functions that way.
We do have I know that you don't say much, but we do actually have our lead finance person who attends every single opioid settlement committee. And a lot of times when we have these dates, there are certain dates that she informs how long it will take to actually get the budgets completed. her deadlines, what has to be done, and that is across all state agencies. In addition to that, I just want to mention too, thinking about programmatic updates, in order to get actual, like, I think Director Leclerc, you had mentioned that, is getting those programmatic updates. Sometimes it matches a little bit with the budgets, right? And when the spent and all of that stuff is completed, because that's when the contracts end. It depends, each agency is different and each contract is different. And then we think about the federal stuff. I think Adi, you had said that specifically, is where does that fit in the bigger picture? So I only happen to know the CDC funding, federal funding is on a different timeline. And almost all of these programs are braided. There's only very few that are just settlement funded. Most are actually braided with either CDC funds, SAMHSA funds, Medicaid, in one way, like it's brick and mortar, for instance, for treatment. That is to increase beds and build facilities, but the services are Medicaid services.
Yep, Adi.
So, couple things. One is I do agree with Dr. Chan, and he got advice. I think you agree as well, that moving the last meeting, like the August meeting, to as late as possible in September, I think would be ideal. Also, because I think then maybe EOHHS is perhaps even a little bit further along with its own budget planning, and can provide some additional parameters and information and knowledge about where our recommendations fall within their budget. I also think that we have to think about the fact that we just talked about 5 minutes ago that we want to focus on sustainability. And so hopefully year to year, there are not going to be humongous fluctuations in how we spend the money or the amount of money we spend. I mean, that's a little bit hard to predict because you can't always predict what the is and what are the emerging needs that we have to respond to. But I think organizations that rely on this funding would welcome predictability, right? The community would welcome predictability. And so I think for us, a lot of it will be like, okay, do we need to make tweaks? Do we need to just like change from here to there a little bit? And so to do that, we will need to have the community, the information from the task force and the community conversation. So if it happens in early May or some point, if that can't be changed, making sure that we mean sort of like not too long after that so that we can start downloading the information. I think that for some of these issues, again, based on past experience, we have to be realistic in that we may not always be able to accomplish what we want to accomplish in one meeting. And sometimes people need to take in the information, chew on it for a while, go back to the organization's principles, discuss it, and then come back and be able to vote. So I think that has to also be thought through. And then just then very briefly on the March 26th, which is I think the one you're pointing to as electing maybe new members.
Yeah.
So at some point we should really discuss like whether we want to use the same process and procedure we did the last time, or whether we want to tweak that process at all. I think this was not my idea, but somebody at some point talked about like interviews or whatever. If we do end up changing that process at all, we may need to also, we may need to tweak that.
Yeah.
Schedule.
That's coming up next. I'd like to have that discussion momentarily. Nope, this is the perfect segue. This is helpful feedback.
One quick thought, and I know I said I was going to be an active listener and not really speaking. But when we think about the budget, I think one of the biggest challenge, in my humble opinion, that this committee is going to have collectively, it's to come to what's that steady budget. Because we cannot say that we have that at this point. Our current budget in the close to 20 million or whatever is that number, that is not the sustainable budget because we know we don't have that going forward. It's a much more reduced budget. And I think to get to what you're talking about, we need to think through collectively, what is that study going forward budget? So we can really hold ourselves accountable to that, regardless of how much more money we see that is coming in, because then there's the tendency to say, let me spend it, because the urge and the need is there. But if we want to get to sustainability and the conversation that you're talking about, and how much are we going to need to invest, how do we make that investment, we also need to decide of what that steady ongoing budget looks like. Is it a $10 million budget? Is it a $7 million budget? I don't know. It's not, it's for the collective wisdom of this group to know and to think through. And that's a conversation that I think it's important to have as we think through this upcoming.
Okay. This is great feedback, folks. We'll take this, think about maybe going back to the community about shifting the time of the task force community conversations, trying to play around with the summer issue. And then Adi, I loved your point about making sure, that was my priority as well, is to make sure that we've got time to digest the information and then vote. That would be my preference, honestly, to not push that all into one meeting, but to take time at some point, maybe that's June or early July, to give you all the information, let it sit, and then come back and vote. So that's the only priority I have, really, is to disentangle those two pieces.
Don't let it sit too long.
Yeah.
Some of us are old.
True, true. Good point.
Really fast.
Yeah, that's true. We'll keep playing around with the timeline. It doesn't need to be on a monthly cadence necessarily either. So, okay, great. Any other feedback before we go on to the discussion about how to elect new members? Yeah, Director.
I'm not quite sure. We get a bunch of resumes. Is there a nominating committee? Is there a recommendation?
Yeah, let's go to that discussion. So do you want to go to the next slide, Mariama?
Before we move on, I just want to clarify, just so we can get calendar invites on your calendars. Are we comfortable with the March being the next meeting? I'm not sure if we got clarification on that for this year. I don't. So that we can at least get a calendar invite on your calendars, because right now you don't have one, and I don't mean to go into logistics, but that's what we do at EOHHS, just to make sure that you all are informed ahead of time.
This says April, March.
Yeah, sorry, that was a typo.
Oh,
Yeah, March 26th.
After the fact.
Yeah, March.
Sorry about that.
Yeah, sorry about that.
It was a test.
Okay,
Everyone's paying attention.
Okay,
That's a yes.
The fact that you were paying attention.
that's right.
Okay, let's go to the discussion about election of new members. Kathy, I think you were going to walk through this slide, and then I'll lead the discussion of the process for the votes. Yep.
I'm going to go through this very quickly. Under the settlement agreement, in reviewing it, this is some of the turnover that's coming about. I just wanted to make note that under the settlement agreement, it has 3-year seats for all counties. We do have a couple of new members from counties because, sadly, we lost Bob Hodling, who was actually a dear friend, and that was a sad loss. And we also had a transition again for Kent County with Chief Arone joining us. And then we also have Bristol and we have Patricia. And there was a transition there because of role changes. So we're going to start that 3-year from when they sat. So this is what's left. We have Washington County, we have Providence, and we have Newport County representatives. So those are the 3 for the counties, and we will work with the League of Cities and Towns as we do and inform them and let them know. They actually expire in the end of February, but I think that it's safe to say we'll get that process going. I have informed the league already. And then we have our state with Senator Miller. I'm so used to seeing him here. He is not here. So we, EOHHS will work on that and getting that working with the Senate to get that appointment to fill that seat. And then these are the 2 where we need to talk about the process that we already had. And this is a voted process where the committee actually decides and votes on those 2 seats. And that's the community representative and the expert. And Angie, your seat is in sadly, but you have every opportunity to apply again. And also Dr. Burke. So those are the two spaces or the two seats that are up in April.
So let's talk about that process. Just for awareness, I know the expert representatives, maybe the community representatives too, the term lengths actually vary so that there's staggering turnover. So as an expert, mine was actually the shortest, then Justin's, and Dennis is the longest. So you're here for another year. So that's why Justin's term is coming up in April. Okay, so let's go to the next slide, Mariama. So last year, the process was as followed. EOHHS developed an application form which asked about some demographics, reasons why an individual would like to serve on the committee, their background, whether they had lived or living experience. Those surveys were distributed to the community. We had a relatively large number of people apply. I want to say more than 20, Kathy, would you say?
I believe.
Yeah. And then that information was brought to you as a committee. And then at the meeting, we discussed those applications, and then there was a vote, if you recall. And that is when Dr. McAdoo joined us. One piece that I think Adi, you brought up was that at last year's vote, we did not permit applicants to interview or to present. They could be present in the meeting, but we did not ask them and did not permit them actually to make a statement or make a presentation. So I wanted to ask the group this year if you'd like to follow that same process. If you do think we should give people an opportunity to make brief presentations, we'd have to think about the parameters of that. But really, it is up to you as a committee to decide how you would like to elect both the community representative and the expert representative this year.
I'm in support of present. I think sometimes when you follow the application, some people are better with the written form and being able to allow people to actually say a few words in addition to the application, balance it out.
Okay. Yeah,
The
Alex.
next thing that comes to mind though is if we have 20 applicants, that's that this amount of time, of course.
Yep.
So
Yeah.
we might, if we did go the path where we wanted to have some folks here present, they're going to make their pitch, explain to us that what we have a committee that we as a group would probably perhaps want to like turn that down to maybe 5 people in advance, probably. You know, I don't know what it would look like.
Process. Thoughts? Yes, Director.
Can I suggest maybe a little alternative?
Yeah, please.
If you had a nominating committee made up of members that would whittle down to 20, top 2, and they get submitted or whatever else the parameters you want to set, that would still allow nominations from the floor, but at least there'd be a recommendation coming from some committee who would have spent hours looking at resumes and interviews, probably.
That's interesting. I assume that's allowable, would be a subcommittee.
You can have a subcommittee
Yeah.
as long as it's public too.
It has to be a public meeting. That's the only thing. It would have to be a public meeting. Or we'll refer to the AG.
It was really But here's what I can do. I can take this back to them. And
Okay.
I think you are right about the public meeting. I think you're pretty sure you are, but before I definitively say that, let me take it back to my office and see what guidance I can get back. I do think that, because I have been sort of thinking through how to narrow down this process. And one possible way is, let's just say we had 20 applications, just use that number, they're circulated. And maybe every member of the committee can sort of transmit their top 2, just like top 3, whatever it is, back to the staff of the, of this committee. So back to EOHHS, and then you guys do some noodling of the recommendations and see who the top vote getters are. And maybe that whittles it down. If there's some like consensus or it whittles it down. And those are the individuals who can be invited to present. That's another, maybe another way to go, going about it. But I do like the idea of nominating committee. Although that kind of was accomplished by the staff, by Carrie and the staff last time, where they effectively presented
Like,
tiered recommendations. I think maybe part of the problem with that was the timing. It was presented like on the day, or I think that we were asked to make decisions. Whereas if that was provided in advance.
Yeah. Alex, did you want to add anything?
I was gonna say, a minor recommendation is if there's an alternative was like all of us reading like all 20 or 30 however many applications that they have, just borrowing from our approaches in academia. We have lots of students who are applying for like a doctoral program or something like that. Split applications across a lot of people and everyone reviews say 3 to 5, then you have a rubric, but I don't know if I'm making this messier.
I do like the idea of doing some of that work in advance. I assume we could transmit the applications to all of you electronically and then get feedback or some kind of ranking. And we could synthesize that and then let the top, say, 5 people know in advance that their applications will be discussed at the March meeting and that they would be invited to present. That's one proposal. So then both you and they know in advance.
Well, we better get that information out.
Yes.
Team.
Yes. But the survey should be available still. It captured those domains, which I thought were very reasonable. One thing I did want to ask though is are there other domains that you would like to add to the form? We put a focus on diversity of both the individual broadly and diversity of, organizational representation diversity from different sectors, different backgrounds, experiences, so on. That sound good? Great. Okay. Excellent. So we can take that back and get going on that process then. Kathy, was there anything else you wanted to ask about this? That sounds good. Okay, great.
Thank you, everybody.
Perfect. Thank you all. So we're moving now into the final piece and then public comment. I wanted to make sure we dedicated enough time for public comment today, but did want to give some time for any final thoughts from the committee members before we move into the public comment period before we aim to wrap up right at 2:30. Yep, Justin.
Very briefly, I apologize, but a thought that's been linked since the beginning. At a certain point, as our funding dwindles, I imagine part of our charge is identifying programs that have been funded that are very worthwhile and are something that should be prioritized for sustainability. And I think about Senator Miller talking about OSAC monies for emergencies. They're sustainable things that we know work should be part of the General Assembly budget, and saying these are the high priority programs that are clearly working that no longer meet criteria for emergency, but are criteria for evidence-based sustainable solutions. And the recommendation is to somehow have these 2 or 3 projects be prioritized for other forms of long-term funding not coming from OSAC funds.
Sense.
Just a
Yeah. Another. Perfect. Yeah. Oh, Director. Thanks. Yep.
That it's been our charge to allocate funding pillars and buckets.
Yeah.
We may need more information than pillars and buckets if we're going to make those kinds of recommendations, so that we know exactly what amount of funds is in a contract for what deliverable. Because by reducing or changing the allocation for the pillars, there is no input from this committee as to where that gets allocated in those particular areas. So especially if you're cutting back. If you're expanding, then that's a different issue. So we may have to give some thought about what kind of information would be needed in order to make some decisions based upon allocation than just reducing a particular pillar.
Thank you for making that point. I didn't want to give the impression that the only thing we do is allocate percentages by pillar. That's sort of an organizational heuristic. And then we can also identify specific areas that we want to invest in. Trauma supports would be a great example, right? So we say as a committee, we feel there's a real need in the community to provide more support for people who are managing overdoses day in and day out, so that we identified that as a priority. So we can get down to that level, is my understanding. We can't get down to the level of program, but we can provide EOHHS with recommendations on topics within those buckets, right? Overdose prevention centers, et cetera, et cetera.
And that's perfect. I wanted to clarify that because specific programs or organizations, we cannot really do that because from state procurement processes, we are obligated to do all of the funding on a competitive way unless it's such a specific program that does not exist at all in any other place, or an organization that's a unique organization. No other organization such as that one exists, and you believe strongly that needs to be funded, that's we can do. But most of the time, it needs to be through a competitive process. And so, but identifying beyond prevention, what kind of prevention you want to focus. If it's prevention focused on youth, prevention focused on school-based activities, or prevention focused on community-based activities, as an example, that we can, because then it's up for the state to create a competitive process, procurement process, and language that targets the applications to that specific aim that you are identifying as a committee.
And this was a good segue as well. I wanted to draw your attention to the December report that Kathy prepared. So on page 5, you do have the allocations by pillar, and then also by these topic areas that the secretary is highlighting. So that information is available to you. Those represent, actually both fiscal year 23, 24, and 25 allocations. So that information is available, but it sounds like there's a need for even more too. So we can certainly work on that.
Well, I think that to the point of this, I want to say first and foremost, I want to say that I drafted this, and I want to say that it was all of the state agencies that provided feedback for this. So I want to acknowledge that the Department of Health, the Department of the Department of Health, BHDDH, and in stewardship, it's the Department of Corrections, as well as information from our philanthropy partners at Rhode Island Foundation, that this was all actually developed in partnership with everybody. And also thank the EOHHS staff, data, and our evaluator and our finance folks, just because I don't want to take full credit for all of it because I didn't do it all. I think that in here, this gets to your point, Director Leclerc, of those specific things that you were talking about. And then if you look at the end, it does highlight some of those programs with some data as well. And I was going to say this when you were all having the discussion, but I wanted you all to have the discussion. We can make this better, but this is kind of where we are providing a lot of that information, and this is going directly to the General Assembly because we're charged with doing that. And we have pretty consistently shared that here in this group, but this is one way of maybe utilizing this doing better, right, as we go along, and giving you a little bit more information than this, but I just wanted to kind of highlight that. Thank you, Brandon.
Yeah. So that is there. And we can make this available electronically as well.
Yeah, we're going to put it on the EOHHS website as well.
So yeah, this is public, this is publicly available, right? Yeah. Okay, great. Any other last comments? Move to public comment. Yep, Dennis?
Just public comment, I have to check myself. Requesting training to get to
oxygen use for overdose response training.
Speak up.
Oh, I need to speak up.
Yeah.
I have to leave. For now, I have another training to go to, overdose response oxygen training, starting at 2:30. I have to excuse myself from the meeting. I'm sorry. I'd like to stay, but I just can't miss this training. So.
And why is that training? Do you have an announcement or anything to announce? If you don't, that's okay.
So Project Revenue license from the Department of Health.
Yay.
Begin providing services in the Overdose Prevention Center. So we're very excited to do so, but we want to be well trained as possible. So we're working on oxygen as a response, and we have an important training going on today. So I have to do that. But we hope to be providing full OPC services in a week, but that's the hope. We want to have a soft opening. We want to do it slowly. We want to do it safely. We don't want too much at once, so we're going to do a soft opening with invite only certain clients we've seen a lot, we've studied a lot, but until you do it firsthand, it should be taken very seriously and moved into kind of slowly in this kind of approach.
And that's an example of a funded project from the Opioid Settlement Committee. So there you go. We just got a presentation. No, I'm trying to lighten it up. But that is fully funded by the opioid settlement. And I know you have other funding as well, and you're working on sustainability, but that is an investment that was made based on the feedback from this body. And I'm sure Project Weber knew how to apply, and I'm sure you're happy about that.
So again, it's Rhode Island leading the way in so many different directions. This is another one. Have a state regulated prevention center. We're excited, proud of our state having made those choices.
Thanks so much, Dennis. Take care. Okay, let's go to public comment. As a reminder, we'll start with the in-person and then go to Zoom. As a reminder, please keep your comments to 2 minutes. And I'll just remind everyone of the meeting guidelines to be respectful and to avoid, to really focus on the ideas that we're discussing today. So I think I'll go to, is that Mike I see at the front and then to the back there?
I'd like to comment on what expediency. My recollection of having to apply for grants years and years ago. The timeline here is much longer.
Are you sharing?
Yeah, and this is also, I think, the word I'm going to use is political. This is a political process because the approval of these programs is based upon a political decision, not necessarily a professional or informed group's decisions. It has to go before the government. So every day that something is in that process is a day that something doesn't get done. And I think the idea of being able to recognize the things, as was mentioned earlier, the things that are emergent need to be, I mean, people aren't going to wait until something happens before they access something. They're going to be doing what they're doing the entire time. So the faster we can move things along the road here, and maybe you need to have an expedited section, or divide this into things, because what's going to happen 2 years down the road, something gets approved, right, goes through this process and then goes to another process and goes to another process. The question is, what's the relevance 2 years down the road? Is it still going to be relevant? Are people, and what's happened in between? So I think if there's a way to look at most things as emergent, they're not just, oh, well, nice to be able to do this. Everything, and this is opioid settlement. This is to deal with issues that are ongoing every day. And the more we wait, the more we lose. So I just would like to encourage, following up with the director of the court, if there's a way to kind of set 2 buckets that says this is the one that we can afford to play around with and wait to see what happens.
this is the bucket we can't. This is the bucket we need to kind of really move on so that we've got a 6-month window of whatever it is to act. And that's basically it.
Right. Thank you.
Thank you.
Thank you.
Let me just very quickly clarify something because I don't want you to leave the understanding that it takes 2 years to spend our money. Every year we have funding to spend.
No, I understand.
I just want to make sure that folks understand that. And so, and even the application process, it's not taking 2 years. I think Director Leclerc is referring to the state process, the state budget process, where you start today planning for the budget that's going to be in 2 years. But every year you have funding to be allocated to go out there in the community, and that does not take 2 years.
I understand.
Okay, I just want to make sure that it's clear, so folks do not think that it takes 2 years to put money out.
Was there another comment at the back, the gentleman? Yep. Sure.
I'm going to present some data from DEA. This is Dr. Chan. I guess that way. And I didn't get your first name, Dr.
Brandon Marshall.
Let me introduce myself for those. I guess speak of what I'm on. My son passed away, first of all, from just about a year ago, from big cattle. And I found some very disturbing things with this whole program based on the data from DEA, and I'd like to go over it, and it won't take that long. I have some handouts. You mind if I give handouts to people?
You can give handouts to, yeah.
Sure. Come up here.
Nope, please do.
Oh, sure. This is information from DEA. And these packages came to me from URI. And I don't know, has everybody seen these fentanyl test strips? Are you familiar with them? Okay, okay. Well, I received the fentanyl test strip in the mail with some Narcan. And it's how to use them safely or safer use with fentanyl test strips. I hope I have enough. And if you go to the last page, one of the handouts, oh, the DEA handout. All right, everybody, let's start with DEA because that's the most important. DEA has something called National Drug Threat Assessment. It's put out every May. And the last page, if you take that DEA handout and look at the last page, it's a 5-minute video, YouTube. Okay, and basically, there it is right there. Oh, thank you, sir. Okay, by the way, I thought you have to wait a minute. Okay, thank you, your service is fantastic. Okay, everybody should watch that 5-minute DEA chemist. And what he basically says is that when these counterfeit pills are made, okay, does everybody have one of these? Okay. Okay. The reason why DEA has that little speck is because when these counterfeit pills are made, the fentanyl does not mix uniform in these pills, okay? And it's the same thing for heroin, coke, or whatever they put fentanyl in. So therefore, if you, and I think these, and believe me, nobody is more of a supporter than harm reduction than me, provided it works, okay? I mean, after I got out of the service in 1991, I needed a job, and I went back to work in the hospital for the rest of the service, right smack in the middle of AIDS and crack, and I saw I had lifetime then. So you don't want to know, okay? So again, I believe in harm reduction, but it has to work. Needles, clean needles work. If you buy a counterfeit pill off the street, okay, or whatever, heroin, coke, you have to test, based on the data from DEA, you have to test 100% of it. Okay, otherwise, it's Russian roulette. And it's Russian roulette based on that Kristen law that Rhode Island passed. Okay. And the other thing is, you look at that DEA data on page, I think it's page 5, I outlined that. And my foundation, there it is. Yep. My foundation is authorized by DEA to disseminate this information, okay? If you look at the amount of fentanyl in those pills, it varies significantly to just about nothing to 9 milligrams. They average about 2.4 milligrams. 2 milligrams of fentanyl will kill you. Now, if you don't know the metric system, I can explain it to you. A milligram is a gram split up into 1,000 parts. So
Sir,
2 milligrams-
that's 4 minutes. Would you mind wrapping up for us? We have other.
Yes.
Continue this at another meeting.
Thank you. Thank you for your comment.
My son's like, it's only worth 4 minutes.
Do we have other comments on the Zoom? Kathy, I'd like to get to those.
I don't see anybody. Is there any comments on the Zoom? I don't see anybody's hand up.
Does everybody have the handouts? I'll leave the handouts. You can look at this on your own.
And there's more handouts here as
You
well.
want a handout? Okay.
Right.
Thank you, Doctor.
Thank you. Okay, let's go to the final slide. Mariama. So we're just about at time, folks. Our next meeting will be at the end of March, as we discussed, from 1 to 3. So the focus of that meeting will be on reviewing and voting our new members. Please keep an eye on your email. We'll be circulating both the application forms and the applications when they come in. So I'll chat with Kathy about the timeline for that. But thank you all. This has been a very productive meeting. I wish you all a wonderful spring and look forward to seeing you at the end of March again. Thanks so much. Take care.
Thank you.
Thank you. Thanks.